Hi, welcome back to my channel. My name is Ginez with Prenatal Yini. In this video, I will be breaking down the recommendations from the CDC and the WHO on breastfeeding and COVID-19 coronavirus. So if you want to know how to breastfeed your baby safely during this global health emergency, keep on watching. As many of you may know, breast milk is the most complete nutrition for your baby. It also provides antibodies for many illnesses. So as of now, there isn't enough clinical evidence to determine if a mom that breastfeeds is able to spread COVID-19 through her milk. Based on the limited studies that are now available, they have not detected COVID-19 in breast milk. World Health Organization recommends that mom and baby remain together to facilitate skin-to-skin contact and breastfeeding, especially after birth, regardless if mom and or baby have suspected or confirmed case of COVID-19. Here are the recommendations if you have no symptoms of COVID-19. 1. Continue to breastfeed. Breast milk is so amazing that in just 20 minutes of ingesting a foreign virus, antibodies are produced in breast milk. Another thing you want to remember is if you're thinking about weaning or ending your breastfeeding journey, you might want to reconsider and wait until this global health emergency is over. But of course, it's your decision. 2. If you're pumping, you want to make sure that you're cleaning your hands properly before touching your pump and pumping parts and bottles. Also, after pumping, you want to follow the best practices in terms of cleaning and sterilizing your pumping equipment and your bottles. 3. If you're combo feeding, which is feeding breast milk and formula, you always want to give breast milk first and then feed formula. Also, you might want to consider increasing your milk supply. So if you need more information on that, just let me know in the comments below. If you are formula feeding only, you want to follow the best practices on how to safely prepare formula, especially powder formula. Recommendations by the CDC and the WHO continue to change. So you want to make sure that you stay up to date with any new information that becomes available. So I've added their links to their websites below in the description box. So here are the recommendations if you have COVID-19 or you think you have it. 1. Continue to breastfeed if possible. If you're able to continue to breastfeed, make sure that you're wearing a mask covering your nose and your mouth when you're near baby, when you're breastfeeding, when you're holding baby. Also, you want to wash your hands before touching baby or breastfeeding baby. Another thing you want to remember is avoid touching your eyes, nose, mouth, your baby's eye, nose, mouth, because remember, COVID is transmitted via respiratory droplets. So you don't want to keep touching those areas to avoid increasing the risk. Another thing is, remember that skin to skin is still encouraged even if you have COVID-19. You just want to make sure that you do it safely. 2. If you're pumping and you have COVID, you want to continue to follow the guidelines. You want to wash your hands properly, ideally for at least 20 seconds. And then after, you want to clean and sterilize your pumping parts and your pump, including your bottles. And you want to disinfect those surfaces that you touch often. 3. If mom is very sick with COVID-19, the recommendation is to continue to keep mom and baby together if possible. If not, then support mom in expressing her milk so a support person that's healthy, that doesn't have COVID-19, can feed the baby her express milk. And making sure that this person, the support person, is washing her hands before feeding baby. Now, something I want to emphasize, stay home. If you don't have to go outside for something essential, stay home. Now, if you have to go outside and you're breastfeeding or anyone, you want to keep that social distancing. You want to wear a mask. You want to wash your hands with soap and water for at least 20 seconds. And then let's say you have to take baby outside because it's something essential. You do not put a mask on baby. Babies do not breathe well through a mask because their airways are smaller than ours, and we just increase the risk of suffocation. So for children that are younger than 2 years old, they do not wear a mask. So something that you might consider, if possible, you could just carry the baby using a carrier and put a blanket over baby, or put a blanket over the car seat, making sure baby has enough room to breathe, and then that will be the best way to do it. Now, if you need breastfeeding support during this time, just know that most insurance companies in the United States will cover up to 6 visits with a lactation consultant. So you could call your insurance and confirm your lactation services coverage. And then what we've been doing is using telemedicine to provide support during this time. And those consults are also covered through your insurance. So if you need help, please look for help, ask for help. If you found this video helpful, give it a like, share it, and consider subscribing for new videos. In the comments, let me know what was your biggest takeaway. So just remember, stay safe, be well, and thank you so much for watching. I'll see you in the next video. Bye.